by producing a chemical called histamine. Fever with allergy symptoms. When you develop congestion, no matter the cause, the buildup of mucus in your sinuses are often a tract for bacteria. When an infection takes hold, you will be hit with a fever which will last for several days. Congestion are often the results of sinusitis, allergies, or something more serious like the flu virus. It's sometimes hard to understand what's causing your symptoms because a chilly or flu can mimic many of the signs of an allergy. Discovering exactly what's causing your symptoms, albeit they are mild, is vital. Once you recognize the explanation for your symptoms, you will start an efficient treatment plan. And within the case of an allergy, you will take steps to stop symptoms or flare-ups within the future. The key, however, may be a proper diagnosis. How can you diagnose allergy? If you think your symptoms are the results of an allergy, you ought to see your medical care doctor. Your doctor may recommend seeing an allergist, a specialist who can perform allergy tests and diagnose the source of your reaction. An allergist also can find out a treatment decide to reduce or prevent your symptoms. Diagnosing an allergy requires a physical exam. You will be asked for an in-depth personal medical record. A medical record can help your allergist find a connection between your symptoms and your exposure to the allergen or allergens which will be triggering those symptoms. Keeping a log of once you have flare-ups can really help your allergist identifying a cause. For instance, noting when your symptoms appeared and what seasonal changes, if any, were happening within the same time frame can provide important clues to your doctor. Your doctor may recommend a skin prick test to assist diagnose your allergy. During this test, a small amount of an allergen, such as a dust mite or a specific food, is injected slightly below the skin. Your skin's reaction reveals whether or not you are allergic there to particular allergen. Sometimes a biopsy is additionally useful for pinpointing the explanation of an allergy. If an allergy isn't the matter, an infection could also be causing your fever. Conditions like heat prostration also can cause a fever. So what's the treatment to all this? Treating a bacterial infection usually involves taking antibiotics to eliminate a fever and other symptoms. An epidemic usually just needs time to resolve on its own. Treating an allergy often involves using medications called antihistamines. These over-the-counter medicines block or lessen the quantity of histamine your body produces in response to an allergen. Allergy shots and special shots of steroids can also help reduce symptoms from an allergy. If you have got seasonal allergies, an annual allergy shot may assist you to avoid symptoms when your allergens are in